This is a case of a walk in the woods leading to multi-organ dysfunction. A 70-year-old female presented to the Mass General Brigham Salem Hospital with reports of 2 weeks of daily fevers with a Tmax of 102 Fahrenheit. The review of symptoms was positive for diarrhea, abdominal discomfort, and left-sided neck pain. She also reported having 2 tick bites in the week preceding the initial symptoms. One of them was identified as a Lone Star tick. She was afebrile on admission with a heart rate of 99, a respiratory rate of 18, and normal blood pressure in saturating 93% on room air. She was lethargic but fully oriented. Her neck was supple without meningismus. She did not have any skin rashes, but she had extensive ecchymosis in the upper extremities. The rest of her physical exam was unremarkable. Lab work showed hyponatremia of 127, hypokalemia of 2.9, an acute kidney injury with a creatinine of 5.5, a bicarbonate of 8 with an anion gap of 35, and a venous pH of 7.2. She also had acute microcytic anemia with a hemoglobin of 7.6, platelets as low as 16, lymphopenia with atypical lymphocytes, elevated inflammatory markers, and a significantly elevated lipase at 4,557. ALT and AST were also elevated. She was initially treated with doxycycline, azithromycin, and oral atovaquone to cover broadly for tick-borne illnesses. Testing came back positive for Ehrlichia Chaffeensis by PCR. Unfortunately, the patient was transferred to the ICU for hemodialysis due to acute kidney injury and metabolic acidosis refractory to conservative management. She completed 14 days of doxycycline, after which she no longer had signs of organ failure. Human monocytic ehrlichiosis can present within a wide spectrum of clinical scenarios, ranging from subclinical and self-limited disease to life-threatening complications. Ehrlichia Chaffeensis is an obligate intracellular gram-negative bacteria, and the Amblyoma americanum is the primary tick vector. Per the CDC, the annual incidence in Massachusetts is around 4.21 per million, with a case fatality rate of nearly 1%. This case illustrates the potential of ehrlichiosis to cause multi-organ damage. Paradoxically, severe disease comes with excessive activation of the immune system, with dysregulated production of chemokines and cytokines. We thought it was reasonable to raise suspicion of hemophagocytic lymphohistiocytosis in this case. HLH is diagnosed when the patient meets 5 out of 9 criteria listed on your right-hand side. Fortunately, the patient responded rather quickly to doxycycline. HLH-specific therapy was no longer required, which is why we did not pursue further investigation into this diagnosis. With this case report, we aim to raise awareness of the potential complications of ehrlichiosis and stress on the importance of early diagnosis and treatment.